So what happens if we compare meniscus repair versus meniscectomy? Okay. So in a meniscus repair, you're actually taking the meniscus and you're taking it back together and you're suturing it back up. Okay. In the meniscectomy, you're trimming pieces out. Okay. And in studies where they're looking at arthroscopic partial meniscectomy versus meniscus repair, the meniscus repair is superior in function, return to sports, and cartilage protection. Okay. The other place where it's definitely more beneficial is reducing eventual osteoarthritis. Okay. We're looking for long-term health of the knee. Okay. We're not looking for the short-term fix. We want this knee to last us for the rest of our lives. And part of the problem with the meniscectomy is that it's actually a bit of a home run. So I talk to surgeons about this all the time. And partial meniscectomy is great because you have a patient that has a bunch of knee pain. You trim out part of that meniscus and they tend to feel really good afterwards. And the research is consistent with this. People that have knee pain from a meniscus tear, the meniscectomy tends to be pretty good in the short term, right? So it's often sold as a faster recovery. Okay. The problem with that is that a meniscectomy, and we'll talk about this a bit later, is going to increase your chance of osteoarthritis, like we talked about before. Okay. So it's not good to tell your patients to get a meniscectomy just because they want a fast return. Okay. So proposing a meniscectomy to a young active patient with the sole pretext that recovery will be more rapid compared with repair is not acceptable despite the patient and societal pressure and medico-economic constraints, right? So if you're an athlete that wants to get back to your sport quickly, sometimes a surgeon will recommend a meniscectomy, and it's probably not the right course of action for long-term health of the joint. So how about if we compare arthritis rates after meniscus repair versus meniscectomy versus a general population that has no meniscus problems whatsoever, okay? So there was a 25 to 50% lower risk of consultation for knee arthritis after a meniscus repair versus a meniscectomy. So if you get a meniscus repair, less osteoarthritis over the course of time. But here's the thing. The consultation rate for knee arthritis after repair is still 2 times higher compared to the general population, okay? So if you get a meniscus repair, that's better than a meniscectomy, but it's still not as good as never having an injury in your knee in the first place. Okay. And the other thing to keep in mind, and we already talked about this, is that a percentage of meniscus repairs will fail over the course of time. I'm looking at 2 studies here, but in this first study, the overall failure rate of meniscal repair in a mean follow-up of 86 months, so that's 7 years, was 19%. Okay. So about a fifth of these meniscus repairs failed over the course of 7 years. Another study of elite American football players. The reason why I chose this study is because we're looking at high-level athletics, okay, which is not the same as the average person that just wants to move weight in the gym, okay? So in a study of elite American football players, found that around a quarter of meniscal repairs had failed by the 5-year follow-up, okay? So getting your meniscus repaired doesn't take the risk of knee arthritis back to baseline, unfortunately, for the majority of folks. How about a meniscus repair versus meniscectomy versus physical therapy? So this was a really cool study. It was recent. I actually couldn't find the full article, unfortunately. If you're listening to this and you have access to this, I'd love to see it. So the study was early surgery or exercise and education for meniscal tears in young adults, right? And they were looking at 121 young adults, aged 18 to 40 years old. The average age was 29. I really like studies like this because the bulk of people that I'm trying to work with regularly are young adults, right? 18 to 40 is, the exact population I tend to work with, okay? They were looking at traumatic meniscus tears, okay? So this was not degenerative or complex tears. This was, I fell, twisted my knee, I was crawling, kneeling, whatever it is, and I had, let's say, a pop, swelling, went to the doctor. Yep, you have a freshly torn meniscus, okay? And these folks were all eligible for surgery. So all folks that could either get repair or meniscectomy, all right? And that's what they looked at. They looked at surgery for these folks. So it's either an arthroscopic partial meniscectomy or repair or 12 weeks of physical therapy, okay? And again, I couldn't get access to this, this study, so I couldn't see the nitty gritty of what exercise they use, but it looks like physical therapy consisted of strength and neuromuscular control exercises. Over the course of this study, which was 12 months long, 16 of the 121 young athletes crossed over to the surgery group, right? And here's the thing. pain, function, and quality of life was the same at 12 months. There was no difference between groups, right? And the thought process here is that of those 16 that cross over to the surgery group, they had this kind of wait and see approach. This is actually pretty common in the other studies I've seen that are comparing surgery with physical therapy. A handful of people will cross over from the physical therapy group over to the surgical group. And it sounds like that's okay. It seems like everyone can try physical therapy, right? And if things aren't going well, you can go to the surgery group. And here's the thing, at 12 months, everyone does about the same, okay? There are a few caveats to this, though. So in this study, I had a few questions, right? So they only followed up on patients for 1 year, right? So the question arises, is osteoarthritis progression different in the physical therapy group following meniscus tear compared to meniscectomy, compared to meniscus repair? So I'd love to see what the knee joint looks like 10, 20, 30 years down the line, because this study is sounding an awful lot like, hey, if you have an acute meniscus tear, you can go ahead and do physical therapy just because at the year mark, you're going to be the same as doing surgery, which sounds phenomenal, to the patient. Patient's like, oh yeah, let's definitely do that. But I would just really like to see what those knees look like in 10, 20, 30 years, because there's a chance that the meniscus repair does better. There's also a chance the meniscectomy does worse, right? Or maybe the physical therapy group does worse. I have no idea. Maybe the physical therapy group outperforms all of them. Okay. We have no idea. It's just that I don't know if this answers all the questions we have for our patients. They're trying to figure out what's best for the long-term health of the joint. And the last piece is that for those who cross over from the physical therapy group to the surgery group, did they have worse outcomes from a re-tear perspective? Because we talked about earlier, the longer you wait to get a meniscus repair, the more likely you are to have a re-tear somewhere down the line. So, the authors concluded that it's okay to trial physical therapy. They also concluded that it was okay to wait until you get surgery, just because the outcomes are about the same at the 1 year mark. But again, we don't know what the outcomes are going to be like 10, 20, 30 years down the line. So I think a lot of this has to be taken with a grain of salt. If you guys are liking what you're listening to right now and you want to continue with the rolling, I have another video for you. It's called When Do Rotator Cuff Repairs Fail? So unfortunately, a chunk of these rotator cuff repair surgeries will fail, right? And it's important as physical therapists to know when these are actually occurring so we can be a little bit more cautious during this time period. So I'll leave a link above my head and go ahead and learn a little bit more about when rotator cuff repairs fail after surgery.